Have you ever looked in the mirror and felt like what you saw was not enough? Not because of how you feel, but because of how the society might see you. This is what many individuals face today. A quiet battle of being visibly different and yet invisibly dismissed. This is something that individuals with skin conditions face every day. And for black-skinned individuals, it's even worse because we're not dealing with just biology, but we're dealing with bias. My name is Dr. Foladavid. I'm a Nigerian visual artist and the current Guinness World Record holder for the largest drawing in the world by an individual. Thank you. I am also a medical doctor. Thank you. And my patients comprise of individuals living with acne, hyperpigmentation, albinism, vitiligo, ichthyosis. I treat these skin conditions, but I also draw them. Why? Because healing goes more than medication. Sometimes what people want or need is to be seen. More than 85% of people have had to deal with acne at some point in their lifetime. And there's a huge psychosocial burden that acne causes, emotionally, socially, interpersonal relationships, and in the way these people live their lives. I've had patients talk to me about losing job opportunities, losing relationships because of severe acne. And I know we have all seen it. People that have really big cysts and zits and acne on their face, and you don't know the quiet battle that they're fighting behind all of that. In some parts of Africa, people living with albinism suffer some bias also. It is believed that their body parts have spiritual powers. And so, these body parts are used in money rituals. A friend of mine was born with freckles, and she was told that her mom drank palm wine when she was pregnant, and that's why she was born with freckles. Even stretch marks, completely common and harmless, have led to a feeling of inadequacy because there's this societal pressure to have smooth skin. Many of these conditions lead to low self-esteem, social isolation, anxiety, fear, and uncertainty about tomorrow. When a patient sits in front of me, I don't just see a diagnosis, I see a story. And when I sketch them, I draw their reality with full dignity because I believe every skin has a story. I tell the story of their skin, and this is where medicine meets meaning. I've seen tears, the good kind, when someone sees their reaction in a portrait and whispers to me, "Is that really me?" Suddenly they don't feel ashamed. They feel powerful. Their perception changes. And with that comes confidence. And this is a very important part in their healing process. Confidence is medicine, and art is how I deliver it. I host exhibitions where people with skin conditions stand beside their portraits. I invite the public not just to observe, but to engage, ask questions, experience and connect. I bring together medical professionals, art enthusiasts, skin enthusiasts. And what we do is not just create conversation, but we also create a community. I've also noticed the warmth and the increase and trust that my patients have had towards me, and not just me, but the entire medical team handling their treatment. Because some of these treatments take a long time. If anybody here has gone through any treatment concerning a particular skin condition, you will find out that it takes months. Some take years, and sometimes most of these conditions have no treatment and just require our support. So this isn't just about art, it's about liberation. So many people live under emotional makeup, afraid to be real, afraid to be raw and different. But the moment we shift the lens, when we tell stories through compassion, we begin to heal what shame has silenced. Skin conditions are often misunderstood, especially on the black skin, from underrepresentation in our textbooks to the stereotypes that we face in society. And people suffer more than just the symptoms. That is why my art focuses on the visibility of black skin in all its conditions: real, scarred, freckled, speckled, radiant. So I use art as an intervention, as a protest, and a love letter. These on the screen are all drawings of my patients. These are all drawings, not pictures. In modern society, creativity often chases trends. But what if art isn't just about aesthetics, but about advocacy? We must redefine creative expression as something that touches lives and not just galleries. Art can be modern medicine if we allow it to speak the truth. What story does your skin tell? So let me ask you again, what if the mirror no longer becomes your enemy, but becomes your canvas? To everyone out here who is living with any skin condition, I say to you today that you are art. To everyone who has felt unseen, I say, in every line, in every pigment, in every scar, you carry your truth, your beauty, and your strength. Let's keep drawing, and let's keep healing. Thank you very much.